guys, welcome to my clinical attachment vlog. Just wanted to do this vlog to share with you the experience. Hang on, I just have to follow the map. I think I have to turn left. So I'm in York today, doing my placement. Just look at how pretty it is. Such a nice day today. Look at this city. It is so beautiful. York is known as the historical city. Okay. I'm doing my placement today and I really wanted to share my experience. The beginning of my second week today, and today I'll be getting more experience in the acute medicine. Also, I'll be working for some time, not working but shadowing for some time in renal medicine, and I will summarize all of my last week's experience in another short video which I'll make when I sit down to play.
Hi guys, welcome back to my YouTube channel. Thank you so much to all the people who have subscribed. Welcome back. And if you're new, welcome, and please take a minute to look around on my YouTube channel, the rest of my videos, and if you like them, please subscribe and leave comments about what kind of videos you'd like me to make. And as you can tell from the title, today's video is about doing a medical elective / clinical attachment in the UK. So I'll be giving information about 3 things mainly today. First of all, about how I went about getting my placement. Second, what my experience during the placement was like. Third, would I recommend, and what kind of things I've learned during my placement. So it'll be like a reflection. And so if you want to know about any of those things, please stick around. A few days ago, I put out an ask on Instagram, and some of the people sent me a few questions, and I'm going to try and answer all these questions as I talk about my experience. One of the first questions that I got asked was, why do a clinical attachment or a medical elective? What is the purpose and how is it helpful for you? So before I get into any of my topics, I would like to answer this question because I feel like if you are to go any further with this video, you should know why it's important for you to do a clinical attachment or a medical elective. So basically, if you go to university abroad, really important that you get some practical experience of going into the hospital, seeing some patients, going into the ward, and really getting the feel of what it's going to be like when you start your practice. Because the experience you have abroad in the hospitals whilst doing your clinical rotations is when you speak to the patients. Of course, you're speaking to the patients in English as much as you can, but mostly when you speak to the patients, you're not able to have full conversations or take history or just have back and forth with the patient in English. But when you move back, if you intend to move back, you will be expected to speak to the patient in English, so your communication skills have to be impeccable. And in that way, it's really important for you to have experience in a hospital where the main language is English, because there's so much communication going on in the hospital. You have to communicate with the team, you have to communicate with the patients, you have to communicate with other departments over the phone. So it's really important to get those communication skills. Other than the communication skills, there's so many other skills that you will learn from the clinical attachment or medical elective. I think both of these terms, I use them interchangeably. So the other skills, for example, organization skills. So when you go, you will be thrown into a very different environment, because of the environment in the UK and the NHS is very different to other environments. For example, you will need skills such as organization skills, because you'll have loads of tasks when you start. And by doing this attachment, I've learned all these skills, like how to organize all my tasks, how to space them out, because when you go in the morning, hopefully in one of the wards, you will get your list of things that you need to do in the morning. Like you will need to do the round, you will need to brief the other consultants, and you'll need to brief the team, you need to brief the nurses. So this is basically why it's important for you to do a clinical attachment. And when you apply for a clinical attachment, you will hopefully be giving an observantship, I don't know how to say that word. So basically what you're doing is observing. You're not allowed to interact, or you are allowed to interact with patients, but you're not allowed to make any changes to their treatment plans, and you're not allowed to do any like physical work because you're still a student and you're not qualified. So even without having like the authority to do any of these things, you'll still learn a lot because you're following the doctors and basically getting to see how they get along with their day. So this is why it's important to do a clinical attachment, and this is basically what you do in a clinical attachment. Let's get right into it. Number one, how did I go about organizing this placement? So first of all, to get my placement, it was really extremely hard for me because everywhere I would apply, I kept getting the response that all the placements are reserved for the students in England, and that I would have to go through like a 4-month, 6-month vetting process. For example, working a few weeks at a time over the 3-month period. But because I study abroad and I only come to England in my summer vacation or Easter or Christmas time, I didn't have. But what I did was I wrote emails to as many trusts as I could, which was near my town which I live in, so I could increase my chances of getting one placement. So what you want to do is write a letter explaining who you are, where you're from, what you're doing. So I included stuff like which year I'm in, what kind of clinical rotations I've done. Oh, and it's better for you to do a clinical attachment when you've already done some clinical rotations in your university, so in your 4th year. And then in the email you should explain that you want to move back to the UK and that you want to get experience and that you would really benefit from getting this attachment, and send them to as many places as you can to the HR department. What you can also do is you can write the email to a personal contact that you have, which is like a shortcut way of getting a placement, as a lot of people I know have done. So if you know anyone who's already working as a consultant or as a doctor, FY1, FY2, as a part of their job they have to take part in teaching, especially if it's a teaching hospital. So you can write to them asking if they'd be happy to sponsor you, and by sponsor I mean they just have to take responsibility for you and for delegating jobs to you and for where you basically will be during the placement. And once you've done that, they'll hopefully accept you, because here people are very, very helpful, very keen. So if you show keenness and eagerness, they're very likely to reciprocate. So after you've done that, then it's time for you to collect your paperwork. And for the paperwork, there's a list of paperwork that you need. So the paperwork you will need includes, first of all, your transcript. No matter where you apply, almost all of the places will ask you to send them your transcript. So your transcript is basically a list of all the exams you've done and all the grades you've got so far. So it takes a few days, well, it took a few days for my university to prepare the transcript. So if you're applying for the summer, you will be in a better place if you start preparing like 2 or 3 months in advance. So for my placement in the end of July, I started applying in May, around May, so that you can collect all your paperwork in time. So you'll be asked for your transcript, and you'll be asked for a letter from your university, from your dean, saying that you are fit to practice and that they are allowing you to do this placement. You will also need a letter from the university saying that you are a student at that university and you've been enrolled, and like the date you were enrolled. And then you will be asked for your vaccination record. So you will need to get that from your GP. So that should be like a record saying what kind of vaccinations you've had. It's basically for the hospital to know if you're vaccinated against MMR and hepatitis. So once you go into your medical rotations, you should have hepatitis B shots, a course. So you should already collect that and get your vaccinations done before you apply. So this brings me to another one of my asks that I got on Instagram about indemnity insurance. So some of the placements will ask you to provide medical indemnity insurance for yourself. Indemnity insurance for students is basically a kind of insurance that covers you in case you make a mistake during your placement. If you are a medical student in the UK, towards your end of your clinical years, you register with these 2 companies. One of them is called MDU, and the other one, I don't remember the name, but I will put it in the description if anybody wants to know. These 2 companies cover you for your placements, and it's free of charge. And I did try to register with these places, but they got in touch with me saying that they do not provide insurance for international students. So if your placement requires you to get indemnity insurance, you need to apply privately. So for this you can search for insurance companies that provide indemnity for medical students on websites such as Go Compare, and then they give you a quote and then you can pick the cheapest one or the best one for yourself. And so in terms of paperwork, this is all you will need: your own identity documents, some letters from your university, your transcript, a reference from your dean, and after this you should be good to go, and you'll get a start date. You'll get to pick which date you want to work, basically according to your own schedule. And then once you start, now brings us to our second point: what was my experience like whilst I was there? So in terms of my placement, another one of my asks was, how was my schedule? So my work schedule was the exact same as the work schedule of the doctor that I was shadowing. So it was from 9 to 5 most days, and except for the days the doctor was on call, which was from 8 a.m. till 8 p.m. So I was, for my elective, based in 2 different hospitals because I live in Yorkshire. I applied to most of the places within Yorkshire, and the 2 places I was in were York and Halifax. And for my first placement, which was in York, I was in the acute medicine ward, and I also got to have some experience in renal medicine and also in A&E. And in terms of experience, I would say acute medicine is one of the best wards to get your experience in because it includes a lot of different internal medicine subjects, and you will really get to test your knowledge because there was patients in internal medicine from all different kinds of departments. They had been sent there from A&E, from the GPs, some of them self-admitted themselves. So whilst in a placement, rather than focusing on learning all of the clinical stuff, I was focusing more on learning the work schedule side of things. So rather than learning about specific diseases, specific treatments, I was more concerned about learning how the every day-to-day routine is, because I wanted to get a taster of how it would be like moving back as a foundation year 1 or foundation year 2 doctor. And so the schedule included every morning getting a list of all the patients, going on a ward round, talking to each one of those patients, getting a brief history about their treatment so far and why they'd come in, or if they're new, getting their history like from the beginning, recording the history, coming up with a treatment plan, and as the day goes by, getting advice from the consultants from different departments. And sorry, I just had to switch my camera because my battery died. So because I was only there on my placement for 2 weeks at a time, I couldn't really concentrate on learning specific diseases and specific treatments. So instead, I focused on learning about different acute management plans, and because I was in acute medicine, there was loads of different departments involved in that, like acute management of respiratory diseases, acute asthma and how it differs from chronic management, and acute management of acute renal injuries. And these were like things that I hadn't specifically learned before in my clinical rotations, because as a general rule of thumb, we focus more on like the overview. But this placement was a good opportunity for me. So somebody else asked on my Instagram if I was only able to shadow one doctor, or if I have shadowed multiple doctors. So because I did my work placement in 2 different places, I did have the opportunity to work with 2 different doctors. My second placement was in Halifax, and in Halifax I was shadowing a cardiology consultant. And so the cardiology consultant had loads of foundation year 1 doctors, because recently it was foundation year 1 starting day. So I was also able to work alongside the foundation year 1 doctors and see what their schedule was like, which is the most relevant for me, because when I graduate I will be in the foundation year 1 sort of phase. Another one of the questions that I got was whether clinical attachment can only be in one department at one time, or whether you're able to rotate into different departments. So this depends on the sponsoring consultant that you have. So if your consultant has more colleagues in different departments, then they can ask them to let you shadow them. So for example, if you are sponsored by a cardiology consultant, they can ask their colleagues in different departments to let you shadow them. So in my first placement in York, because my consultant was from acute medicine, he was able to ask his colleagues in A&E to let me shadow them. So if you have a consultant in one department, and if you just ask them, they're able to send you to different departments. All in all, I had a really positive experience. I got to learn so much about how the system works, and rather than learning about smaller clinical details, I focused more about the bigger picture and how I fit into the system, so that when I transfer back from my university back to England, I will be able to easily blend in with everybody else, so that my knowledge is not lacking and I will be at the same level as everybody else because I've already had this experience. So I would strongly recommend anyone who is from their end of their third year, fourth year onwards to try and get a placement, because it really is like a very good opportunity for you to get to know what you're trying to come back into. So my experience was actually very humbling, because after you finish like sort of your fourth year going into your fifth year, which is like my penultimate year, you kind of sort of think to yourself, you know so much now, which you do compared to your first year, but you still have no idea how much more there is to learn. So once you start going into practice, you realize how much more you still need to learn. So it's all about background reading. Also, in terms of skills that you need, sometimes I know, especially for my own university, there are certain things that you don't really get a chance to have any hands-on practice with. For example, simple things like veneer punches and IV cannulations, but these are things that foundation year ones are frequently expected to do. So this experience really gave me an eye-opening kind of shock to my system, because I've not had any practice in doing cannulations and veneer punches. But in England, by the time you are in your fifth year, you are supposed to know how to do these things. So I would strongly recommend going to some workshops and getting any experience that you can to learn some of these vital skills, because they will be very, very useful for you when you start your practice. And overall, if you do a medical elective or a clinical attachment, please go in with an open mind, because as soon as you go in, it will be very frustrating in the beginning, because you'll want to do stuff, you'll want to be hands-on and get experience, but it is merely an observership. So all you're doing is observing. You're not allowed to do anything, but try and take the opportunity to learn whatever's going on around you. Try and learn from the medical staff how they are taking histories and how to write like the information, how to summarize it, and how to kind of read them again. So if you look at the files of patients, you will learn how to pick up the main words, and it will be really helpful skill later on, because you need to be very, very quick and on your feet when you're on the go. Another thing that's really important to learn is how to interact with the patients. So when you're doing your observership, learn from the doctors about how they're interacting, what kind of questions they're asking, what kind of information they're getting. So instead of asking about a lot of stuff and then trying to summarize all of that later on when you're clerking for the patients, you need to know how to be concise, because you can't spend all day with one person. So you have to be like very thoughtful about the kind of questions you're asking and the kind of information you're getting, and you have to be okay with saying I don't know something, because there will be times when you are not sure about something, and you need to take comfort in knowing that it's okay to say that you don't know something. And this was something that I learned, that a lot of doctors do say that they're not sure about certain things when the patients ask. So that's another thing that I learned. Another thing that you need to know, which is a fairly new concept, is how to clerk for patients. So the thing about writing down information, as I said before, is like one of the jobs that you'll have in your foundation years. So there's a whole like data system where you need to enter all the information, update the prescriptions, change the prescriptions, order tests, and when you receive the results, that's where you like look them up. So learning how to do that properly. So there's different systems in different trusts, but the more you know, they're all very, very similar. The more you know, the more easily you will pick it up when it comes for you to start your foundation year. So in that way also it was very, very helpful. And that brings us to the end of the video. Thank you so much for watching my video, and if you have any questions about anything that I've said, or if you want to get in touch with me to ask any more details, please do not hesitate in contacting me. I will leave my social media details at the end of this video and trying to put them in the description box below. I'm still new and I'm learning how to make videos. If there's any different kind of topics that you want me to cover, please do let me know, and I will try and make more videos about them. And until next time, goodbye. God is great. Try and study, but also try and keep a balance, which is one of the most important things that I've learned. And good luck. Bye.